My name is Chrysopoulo, and I am president of PRMA Plastic Surgery. The number one method of breast reconstruction that's used really around the world is breast implants. And there's no doubt you can have a very nice reconstruction with implants. But if you're watching this video, it's probably because things haven't turned out according to plan. And what I'd love for you to know is that you probably have other options. A very common problem is visible implant rippling. What this means is that you can actually see the waves in the implant shell through the skin. Another problem is that the breasts can move in a very unnatural way when you use your chest muscle. This happens when implants are placed underneath the main chest muscle or your pec muscle. So then, when you use your chest muscles, it squeezes down on the implant and causes a phenomenon known as breast animation. Implants can also be very cool to the touch. This is because after a mastectomy, most of your tissue has been removed. Your breast gland is removed, and a lot of the fat underneath your skin is also removed. This means that there is little to cover the implant, and since the implant doesn't have a blood supply, the breast feels much cooler to the touch than the rest of your body. This is something that a lot of women don't actually expect, but is very, very common with an implant-based reconstruction. If you needed radiation as part of your breast cancer treatment, you may have also experienced some issues with the implant because of that. Radiation can cause hardening around the implant and increases the chances that you'll suffer from chronic pain with implant-based reconstruction. This is because radiation makes the tissues more tough and leathery and tighter, and over time this tightness can increase and cause discomfort as well as a very visible obvious deformity, because your tissues literally can shrink down over the implant. So in addition to an increased chance of pain, you also have very commonly problems with breast symmetry. A lot of these problems can be fixed with further revision surgery. So you can stick with implants, maybe exchange them out, and have other procedures performed in conjunction with your implant exchange to address the various issues we've talked about. For example, visible implant rippling can be improved with fat injections or fat grafting, also known as lipofilling. This involves liposuction from one part of the body, taking the fat and purifying it and injecting that fat underneath the skin to add more padding on top of the implant, thereby camouflaging it and decreasing the visible ripples. We can also change the location of the implant. So if, for example, you're experiencing significant breast animation, then we can remove the implant from underneath the muscle and place it on top of the muscle instead. And now, when you use your chest muscle, it will no longer move the implant underneath it in an unnatural way. Capsular contracture, which is the thickening of the scar tissue around the implant that causes hardness and discomfort, that can be addressed through scar release or removal of the capsule. That's known as capsulectomy. An option that many women aren't told about, though, is the option of removing their implants altogether and replacing it with their own tissue. Most women are candidates for what we call autologous reconstruction. This involves taking tissue from one part of the body, disconnecting it and transplanting it to the chest to restore the breast volume and shape. And this can be done after implant reconstruction. A very good option that many women aren't told about, unfortunately, is tissue reconstruction. Even if you've had breast reconstruction before with implants, you're still a candidate for implant removal and subsequent reconstruction, further reconstruction using your own tissue. We have lots of tissue options available depending on where you have the tissue. It can be from the lower belly, the abdomen. It can be from your thighs, buttocks, and your back. Most women have many different options, and we can take tissue from several different parts of the body. The most common procedure is the DIEP flap or DIEP flap, which uses the lower abdomen. One of the big benefits of DIEP flap reconstruction, in particular in our practice, is the ability to restore feeling. As you've no doubt experienced, numbness is very common after a mastectomy. The tissue of the lower abdomen that we use during the DIEP flap surgery actually has nerve endings in the skin that are very close, similar to the breast. We use a procedure known as TruSense that allows us to restore feeling to the reconstructed breast by reconnecting nerves in the tissue that we transplant in the DIEP flap to the cut nerves in the mastectomy site.